The bladder is in the caudal abdomen, ventral to the descending colon, and uterus in the intact female. The urethra extends caudally into the pelvic canal and is in part surrounded by the prostate in the male. The size of the bladder partially dictates the portion of the urethra that is accessible by ultrasound in dogs, whereas in cats, the urethra is usually not visible unless obstructed. The trigone or neck of the bladder connects to the proximal urethra, but their junction isn't easy to recognize with ultrasound. In many dogs, we can identify the junctions of both ureters with the bladder, also called urethral papillae, located dorsolaterally on the trigone. Even though the ureters are not visible most of the time, a peristaltic wave bringing urine to the bladder causes enough dilation so that their anechoic lumen can be seen. In the longitudinal plane, with the marker placed cranially, the bladder is scanned from right to left, from one lateral wall to the other. Even though the urine is normally anechoic, we can often see a hyperechoic zone adjacent to the wall. This is caused by a side lobe or grating lobe artifact. Additionally, beam reverberation can participate in a more superficial artifact. These artifacts should not be confused with urinary sediment, which would move when the dog is rotated. Sediment would also have a flat, horizontal interface parallel to the surface of the exam table. Take a look at how thin the bladder wall is. It's practically invisible because the bladder is so distended. In some dogs, when the bladder is nearly empty, the wall is 4 or even 5 mm thick. We need to be careful not to overinterpret this sign as an indication of cystitis. In fact, bladder wall thickness should be evaluated only when the bladder is moderately distended. In such case, it should not exceed 3 mm. The probe is moved toward the bladder neck and then to the junction with the proximal urethra. In this unspayed female dog, we can see the uterus lying just dorsal to the bladder and urethra, with the colon slightly more dorsal. The highly attenuating contents of the colon are causing acoustic shadowing. In the transverse plane, examine the urethra and the bladder right up to the apex cranially. A convex probe enables us, from the shape of the scan zone, to include most of the bladder in the image. A linear probe can be useful in smaller patients. Once again, observe the uterus and colon located dorsally and to the left. Since these three structures are mobile, their right-left relationships will vary. Back in the transverse plane, we can see two small bulges in the lumen of the bladder neck on the dorsal side. These are ureteral papillae or ureterovesical junctions. You should examine these papillae and ureteral jets if you suspect an ectopic ureter. Color or power Doppler may help confirming the presence of urine jet from each of these papillae.